So the cost of mental health, it's been established, it's a staggering 7.2 billion a year, and that's just for Wales, not the whole of UK. And in Wales, there is about 11% of people who have a diagnosed mental health disorder. Does not necessarily mean that everything that has been diagnosed is what's in relation to mental health. It's what has been diagnosed by a mental health professional. So not everything that's recognized as mental health comes within this sphere, because a lot of it goes unreported, it's not diagnosed, and it's not even, people aren't even aware that they have a mental health issue. So when people are faced with, say, economic situations where there's a downturn in the country, when they move from stress towards depression, it's not always recognized. People still feel it's part of stress, it's part of this and that, and it's not recognized as a mental health issue. In relation to the spread between men and women, women are generally more accepting of the fact that they are facing a mental health issue, as opposed to men who don't usually open up. And that's one of the reasons that, unfortunately, men do more self-harm themselves when faced with mental health problems, and they're more successful, it's a very odd term, successful suicides within men as opposed to women. In relation to mental health, the spread isn't very equal across Wales. So the areas, especially like Bridgend or Benliw, Gwent, where there's a high incidence of mental health issues, are the areas with high deprivation. So you can start to make a correlation between the economic conditions, poverty, and mental health disorders. In relation to children, it's worth bearing in mind that the first 2 years of development are the most crucial ones. And what happens is that many mental health disorders have the origins in childhood, and they become evident by the age of 14. So anything that will continue to stick as a mental health disorder or maybe a personality disorder starts from childhood. So it's important to recognize that these early years are the most important ones, and I'll touch base on how we can address it when we go along the slides. In relation to poverty, children of single parent families are twice as likely to have a mental health problem. The suicide rates in those aged 15 and over rose to the highest level at 13, as opposed to, I think it's around 10 in England. But what is very important to bear in mind here is that promoting mental health in a single year cohort of children could lead to benefits over 1 billion in terms of the cost of addressing mental health issues. And promoting mental health is not about preventing something else, but it's, even when we start to promote mental health within children, it can have a very long-lasting positive impact. In terms of older people, the most common issues that older people face are depression and dementia. And one of the factors that lead towards depression is loneliness and falls. And the fear of falls, it becomes a vicious circle sometimes. It leads people towards isolation, and when they're isolated away from other people, and if there's a fall, then that has some catastrophic negative consequences, which then further leads to depression. It just becomes a very vicious circle. But again, is worth bearing in mind. In the context of working age adults, there's a blurred boundary between when does somebody enter the working age, whether it's a very young age as opposed to what used to be the case maybe 10 or 15 years back, and now people are living longer and they're working longer. So the blurred boundary needs to be kept in mind when we talk about working age and older people, because the boundaries are shifting. The employment rates between people with different types of sort of impairments or disorders, whether it's diabetes or some deformity of the limbs. People with mental health and associated issues rank very low, so it's about 12 to 13% of people with mental health who are in employment. In relation to employment, people who are unemployed for over or less than a year face more low life satisfaction, unfortunately face more low worthwhileness, and face more anxiety, as opposed to people who haven't entered the working age or still students, or people who are in employment. Bearing in mind that people who are self-employed, sometimes who slip in and out of employment, face something not at the same level, but something similar to people who are unemployed in terms of these unfortunate factors.